Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. We all know that melanoma is a very lethal form of skin cancer, and the risk of developing a melanoma has increased in recent years. In fact, the American Cancer Society states that 1 in 38 Caucasians and 1 in 1,000 blacks will develop melanoma in their lifetime, according to current data. So the study published in the journal Melanoma Research in December of 2022 should be viewed as being very important and instructive. Now, most people know that we should avoid too much ultraviolet light exposure and protect our skin with proper clothing, hats, sunglasses, and sunscreens to help reduce the risk of melanoma and other forms of skin cancer as well. But the 2022 study in the journal Melanoma Research suggests that regular use of a vitamin D supplement alone may reduce the risk of melanoma by more than 50% after controlling statistically for other important risk factors. Moreover, the patients studied in this trial were all patients who were already at increased risk for melanoma development, including 96 patients who were immune compromised. Overall, the study involved almost 500 dermatology patients who were at increased risk for melanoma development ages 21 to 79 years old. The study showed that regular users of vitamin D supplements had more than a 50% lower incidence of developing melanoma than non-users of vitamin D supplements. As the researchers indicated, other recent studies have provided evidence of the benefits of vitamin D in melanoma as well, such as the association with vitamin D supplementation and less aggressive forms of melanoma. In other words, even in people who develop melanoma, some evidence has shown that the melanoma is less aggressive. This study was conducted in an area of Finland where melanoma incidence is known to be very high. Now, unfortunately, this study showed that vitamin D supplementation did not reduce the severity of photoaging and facial photoaging and other types of skin lesions, including basal cell carcinoma and squamous cell carcinoma. So vitamin D was not protective against a number of these other skin lesions and skin cancers. It appeared that vitamin D supplementation was most impressive in its ability to help to reduce the development of melanoma, but that alone is very impressive and potentially life-saving. The researchers did not comment on what dosage of vitamin D we should be taking each day, but for most people, I think we can assume that 1,000 to 2,000 IUs per day is reasonable, which will usually get your blood level of vitamin D into the protective range against many health conditions, and that protective range would be, most doctors would agree that it should be 85 to 150 nanomoles per liter or 34 to 60 nanograms per milliliter. So I've included the reference for this study in the text below. Thanks for watching, and I'll see you next time.